All right, if you're just joining us, welcome to our webinar. It's going to begin shortly. I'm going to give everybody just a second or two to get in, sit down, and get comfortable because this is an amazing topic that we're going to talk about today. While you're all getting ready, I just want to remind you that this is sponsored by Every Cat Health Foundation, a free webinar, a topic that touches so many of our cats' lives, chronic kidney disease. And it is through the generous donations of our sponsors and our donors that we are able to continue to fund studies that will hopefully someday, if nothing else, minimize CKD and at least some manner of management that works. So unfortunately, those kidneys are those kind of things that once they're broke, they don't get fixed. So and I don't see kidney transplants being cost effective in my lifetime anyway. But so more research is needed. If you want to give a donation, I'll give you just a second, and there will be a place where you can at the end, there's a QR code where you can hit it and jump on and make a donation. We do have a specific kidney fund if you would like to donate to that. All right, I'm going to go ahead and introduce our speaker. Dr. Dottie LaFlamme received her MS in ruminant nutrition, her DVM, and her PhD in nutrition and physiology, all from the University of Georgia. She completed her clinical nutrition residency at an Alpo postdoctoral fellow in clinical nutrition. She worked for Purina from 1990 until she retired in 2015. Her research focused primarily on therapeutic nutrition and specifically obesity management and geriatric nutrition, which we will probably talk about in this. So without further ado, Dr. LaFlamme.
Thank you so much, and thank you everybody for joining us today. We are going to be talking about chronic kidney disease in cats, covering what's focused on the diet, what do we know, what don't we know, and maybe what we need to know. So with that, let's jump into it. Chronic kidney disease in cats, it's common, affecting, depending on which study you look at, up to about 33%, 1 in 3 geriatric cats has some degree of chronic kidney disease. Typically, it has very slow progression. So if you diagnose it early in a cat, chances are they're going to be living with that disease for many, many years. What's interesting about cats and what sets them apart from dogs is the type of kidney disease they have, predominantly influencing the tubular. So it's called tubulointerstitial fibrosis with inflammation, as opposed to dogs who tend to have glomerular disease much more commonly. And that does have an impact, as we will touch on later in the talk. So we are dealing with damage to the kidney or loss of kidney function. So it's important to think about what is the normal function of the normal healthy kidney. It's all about maintaining balance. So the kidneys play key roles in maintaining body fluid volume, osmolality, electrolyte balance. They have a role in regulation of blood pressure. They have an important role in balancing acid base and keeping your pH right. They have a role in production and secretion of hormones, predominantly regulatory hormones, and they have a key role in excretion of waste products, whether those are metabolic waste products or toxins or other items that may be in the body, and even drugs that need to be excreted. So they have an important role. And when they stop functioning, we start to lose these balance functions. And so one of the key roles of the diet relative to the kidneys is help the damaged kidney to help it to maintain the balance through modification of the diet. The nutrients that come to mind for most people when you say, what's the diet for cats with kidney disease or people with kidney disease? The first thing most people say is protein. other nutrients that are important or might be important, notice the question marks here. Is protein modification important? Is phosphorus modification, sodium, potassium, omega-3 fatty acids, or alkalinizing buffers? These are all nutrients we're going to talk about this hour. And the question mark for all of them is just how important is it? But what's not shown here that we're going to touch at the very end is the importance, in addition to the potential nutrient modification, is the importance of maintaining body weight, lean body mass, and nutritional adequacy in these cats as they live into their senior years. We're going to start with protein. So high protein for many, many years has been suggested to not only be an issue in chronic kidney disease, it's been suggested to be a cause of kidney disease, especially in rats, and by extrapolation in dogs and in cats. But the early studies that led us to think that protein was important, they did not take into account confounding variables, such as protein sources are usually also high in phosphates. High protein diets are often high in calories, and protein sources are often acidifying, and those can influence the kidneys in ways in addition to the protein. And so the big association, if we will, is between protein and phosphorus. And so the first study, and to date the only study, that actually looked to tease out the effect of protein versus phosphorus was done in dogs. And it was a study where 2 different levels of protein and 2 different levels of phosphorus were used to try and tease out which one was having an effect on the dog's kidneys. And as it turns out, the phosphorus restricted diet was very beneficial. The high phosphate diet was detrimental, and the protein, whether high or low, had no impact whatsoever. So it didn't appear, based on that one study, that protein restriction would be beneficial even in dogs, but there's other types of kidney disease in dogs, including a specific genetic disease where dogs develop proteinuria, which is protein in the urine, which is not normal. And restricting protein helped to reduce proteinuria, and so help dogs live longer because proteinuria has adverse effects on the kidney. So there are some suggestions that protein restriction may be beneficial in dogs, but it's not strong evidence. And even in the human literature now, they're starting to question how important protein restriction is as opposed to phosphorus restriction, which we'll talk about later. But we're here to talk about cats. And cats and dogs differ. I already mentioned the type of kidney disease they have is different. Glomerular in the cats versus in the dogs versus tubular in the cats. So how important would protein restriction be for cats? There's actually 2 different studies in cats that looked at this. One was looking at 52% protein on a dry basis compared to 28% protein. It was a 1-year study in cats with experimental chronic kidney disease. And in that study, those cats fed the high protein diet. They did develop greater renal pathology. Their BUN, or serum urea nitrogen, was increased, and their urine protein creatinine ratio was increased. In other words, they had proteinuria. But the cats on the high protein diet developed hypokalemia, or low blood potassium. And it turns out that the high protein diet did not have enough potassium in it. And so the investigators realized this while the study was underway, and they fixed it after 3 months. And this graph, what you can see here, is actually the urine protein creatinine ratio at 3 months, 6 months, 9 months, and 12 months of the study. The black bar is the cats fed the low protein diet. The red bar is cats fed the high protein diet. And you can see that proteinuria is higher in all cases in cats fed the high protein diet. But you can see that most of that effect was seen in that first 3 months before potassium was added. Then once potassium was added, that urine protein creatinine ratio came down and down towards normal. So you have to wonder if the potassium had not been deficient, would we have seen this effect at all? And we're going to see an answer to that in the next, in just a minute. But once the study was done, so 9 months on a adequate potassium diet, once that study was done, the final results were that the cats fed the high protein diet. Yes, they had greater renal pathology, but they also had lower serum creatinine. Their GFR was better, and they had better body weight by the end of the study, which are beneficial things. And so you have to wonder if the potassium was adequate, would we have seen any difference at all? And so some years later, another study was done using the same kind of model, the same levels of dietary protein, but adequate potassium. Now, this study looked not just at protein, but again, it was a factorial study. They looked not only at protein, but also the effect of calories, because there's some evidence that animals, whether it's rats or cats, fed a high protein diet are going to consume more calories when they're fed a low protein diet. Perhaps it doesn't taste as well, whatever it might be, but they consume less calories. And fewer calories has been shown to be beneficial relative to kidney health, at least in rats. In this subsequent study, then, with the differences in calorie intake, but the same protein levels and adequate potassium, this study found no effect of protein. So high protein did not cause any of the damages. There was greater renal pathology only in the cats fed the higher calorie intake. So this doesn't support protein restriction as being beneficial. But what about cats that do have proteinuria? We do know from many clinical studies that increased urine protein creatinine ratio is a negative prognosticator in cats with chronic kidney disease. But this may not be an indicator of anything more than the fact that those cats may have more advanced disease at the time of the analysis. But certainly cats with greater urine protein creatinine ratios have reduced survival compared to those that have less. So UPC or proteinuria is important, and that's the reason that we generally like to treat that. However, there's no evidence that restriction of dietary protein can reduce proteinuria in cats. So treating proteinuria is important, but restriction of dietary protein does not seem to be an effective way to treat it. Okay, so continuing, there's no good evidence that high protein intake worsens chronic kidney disease in cats or that lower protein intake aids in chronic kidney disease. That said, there's several studies that show that commercial renal diets do provide benefits compared to maintenance diets. And commercial renal diets are lower in protein compared to maintenance diets. So that suggests, well, maybe protein, but the reality is maintenance diets differ in many ways from renal diets. So renal diets are lower in protein, sure, but they're also lower in phosphorus. They also have other nutrients that are adjusted, and those include the nutrients that we're going to talk about as we continue. So it's not necessarily saying that protein restriction is beneficial. And in reality, that's one of the things we don't know, because there is currently no scientific evidence to say that protein restriction is beneficial. Jumping on to the next nutrient, potassium. I mentioned in the last few slides how potassium restriction seemed to be associated with increased urine protein creatinine ratio in those cats. There's evidence that hypokalemia, or low potassium in the blood, is a common finding in cats with chronic kidney disease, and that's probably due to excessive urinary losses. It is difficult really to assess the status of potassium by taking a blood sample, because the muscles contain a lot of the potassium and the body can be nearly totally depleted before the plasma levels go low. So it's often overlooked, if you will, because it's hard to diagnose. The other thing to consider is metabolic acidosis, which is also common in chronic kidney disease, can contribute to the loss of potassium. Acidifying diets can also contribute to the loss of potassium. And as mentioned, hypokalemia in and of itself seems to be able to induce renal dysfunction in cats, as shown in a number of older studies. These were studies back when acidification of the diet was first being introduced as a way to control struvite uroliths in cats. And it was found at that point that acidifying the diet without increasing potassium led to a loss of potassium. And in many of those cats, then they developed renal dysfunction. And in a clinical study by Buffington and Bartola, they actually showed it in a research setting that these acidifying diets actually induced kidney dysfunction. And so it's very important to consider that we have enough potassium. It's also, we're going to talk about acid base in a minute. It's also important to avoid acidifying diets in cats with chronic kidney disease. What's interesting, though, is all of this evidence shows us that potassium is important. Avoiding potassium deficiency is important. And yet, when cats had adequate potassium in their diet and were not hypokalemic, providing extra potassium in cats with chronic kidney disease did not provide any clinical benefit. So I think this is another area where we need further investigation to know exactly how much potassium cats with kidney disease need to have, and if and under what circumstances would increasing or decreasing that be of any value. Our next nutrient of concern is sodium. Now, sodium-restricted diets have been recommended for decades as a means to control primary or secondary hypertension or high blood pressure. And hypertension is a common finding secondary to chronic kidney disease in both cats and dogs. However, neither dogs nor cats seem to be sodium sensitive relative to blood pressure. So restricting sodium does not cause blood pressure to go down and vice versa in the cats. As a matter of fact, there's a single epidemiologic study that suggests that higher sodium intake was actually associated with a lower risk for development of kidney disease in cats. Now, one thing that we are observing in recent years is that low dietary sodium, it stimulates the renin-angiotensin-aldosterone or RAS system, which we might expect that to happen because that system, the RAS system, is an important part of maintaining sodium balance. So let me share with you a couple of studies that looked at the effect of dietary sodium on the RAS system and on blood pressure in cats. The first was done with healthy aging cats, and they were fed 0.4 or 1.4 sodium, so a moderate level compared to a moderately high level. And in that study, there was no impact on blood pressure, but the lower level did trigger an increase in the RAS system, which basically tries to preserve sodium in the body and reduce the amount of sodium being excreted. In a different study, there was a group of healthy cats and cats with induced chronic kidney disease fed 3 different levels of sodium, 0.2, 0.4, and 0.8% on a dry basis. Again, no effect, even in the kidney disease cats, no effect on blood pressure. However, those cats fed the low sodium diet showed a decrease in glomerular filtration rate. They showed an increase in serum creatinine and serum urea nitrogen. They showed an increase in potassium loss, in some cases hypokalemia, and an increase in the RAS system. So what that's telling us is that there's really no benefit to restricting sodium relative to blood pressure, but taking sodium too low can trigger the RAS system and may have adverse effects. So let's talk about the RAS system briefly. It is increased in cats with chronic kidney disease, and it's increased early on. It can be stimulated by low sodium, but also by metabolic acidosis. And the increase in the RAS production correlates with the severity of CKD in cats. Now, not saying that one, don't really know what's cause versus effect, but there's a strong correlation there. One thing about the renin-angiotensin system is it promotes vasoconstriction, which can actually increase glomerular pressure, and that can contribute to proteinuria. It also can contribute to renal inflammation and fibrosis. So a stimulation of the RAS system has the chance to increase proteinuria and increase damage to the kidneys. So it's important to control it. In studies in rats and in humans with kidney disease, ACE inhibitors decreased fibrosis and slowed the progression of chronic kidney disease. Now, there have been some studies with ACE inhibitors in cats with kidney disease, was shown to decrease proteinuria, shown to decrease serum creatinine, and non-statistically significantly, that's key, but it slowed the progression of chronic kidney disease in cats. And again, not statistically significant, but there was a numeric or directional effect that increased survival in cats that were treated with the ACE inhibitor. And looking at cats that had high proteinuria, it basically doubled or tripled the length of life of these cats. So treating with ACE inhibitors appears to be important, and I think most veterinarians today grab ACE inhibitors as part of their medical portfolio. And so that's an important thing to consider, although I think we still need more research in this area to know if it truly does slow progression and increase survival, but the indications are there. That said, sodium restriction, which promotes the RAS system, is probably not an appropriate approach for addressing this. Our next nutrient, alkalinizing buffers. So it's not a single nutrient, it's a collection of nutrients that have an effect on the pH. One of the things to consider about chronic kidney disease is metabolic acidosis is very common, especially in advanced CKD. Now, we don't really have good measures of acidosis in the early stages because serum bicarbonate is not that sensitive. So we don't recognize it in early stages of kidney disease, but it is quite common in late stages. I want to point out here an interesting association or just an interesting observation. Clinical signs of metabolic acidosis: anorexia, vomiting, nausea, loss of weight, loss of lean body mass, lethargy, muscle mass. Does that sound familiar? It should, because clinical signs of chronic kidney disease are very much the same: anorexia, vomiting, loss of weight, lean body mass, and lethargy. So one could question, are these signs that occur commonly in cats with kidney disease related to metabolic acidosis rather just than other aspects of the disease? And should we focus on trying to correct metabolic acidosis even in its early stages? We don't have much data in cats, but if we look at rats and humans, we know that metabolic acidosis is associated with CKD progression. We know that metabolic acidosis stimulates parathyroid hormone. We know that metabolic acidosis has a negative impact on protein turnover and nutritional status, which means that protein breakdown is more likely to occur with less protein synthesis, leading to a loss of lean body mass, leading to negative nitrogen and protein balance. What's very interesting is that these effects can occur even within normal blood pH. So just like on the low range of pH of normal versus the high range of normal, you can actually see an effect on protein turnover in humans. We don't have that data in cats. In these various studies, they all improved with the addition of bicarbonate. So no other changes, before and after, just an increase in bicarbonate, which kind of suggests that this is something that should be investigated in cats. Right now, there's just small-scale human studies completed, but large-scale studies are currently underway, and we'll get more information out of those. But there's really no data talking about this in dogs or cats. Like I mentioned, the evidence of acidosis in cats is there, but only in the more advanced cases, because we don't really have a good sensitive way to look at the changes early on. We don't have studies looking at just bicarbonate, but there are multiple studies with the renal diets, which include an alkalinizing effect, that do show clinical improvements. Again, as we mentioned earlier, renal diets differ from maintenance diets in so many different ways, but acid base is one of the things, and so that may be an important one. But currently, this is not something that's talked about by IRIS because there's really no data there, and it's an area that needs to be investigated, in my opinion. The next nutrient of concern is the omega-3 fatty acids. We do know that chronic kidney disease is associated with inflammation and changes in renal hemodynamics, and omega-3 fatty acids can have an impact on both of those characteristics. That said, there's not much evidence in cats or even in dogs looking at this. There's one study that was done in dogs with chronic kidney disease where 15% of the diet is fish oil. That's a massive amount of fish oil. Resulted in a correction to glomerular hypertension and reduced progression of CKD. But that's a massive amount of fish oil. As far as cats, there's no such studies. There is one retrospective study in cats fed various renal diets, and amongst those renal diets, the best response happened to be in the diet with the highest EPA, which eicosapentaenoic acid, which is one of the omega-3 fatty acids. Now, was the best response because it had the highest omega-3s, or it had the highest omega-3s and other factors in the diet? Again, we don't know. And finally, getting to what I think is the most important nutrient of concern in chronic kidney disease is phosphorus. We know that elevated serum phosphorus is common in advanced chronic kidney disease in basically all species, and it's associated with increased mortality in kidney disease patients. It's interesting that even within the normal range in research animals, higher serum phosphate is associated with increased risk for renal damage. So phosphorus is important, but it's important also to note that phosphorus metabolism appears to be disrupted early in chronic kidney disease, but adaptations, which we'll talk about momentarily, keep serum phosphorus within the normal physiologic range. So there's changes in, let's just call it phosphorus balance or phosphorus metabolism, and yet the blood phosphorus levels stay completely normal. And because this is happening, because of homeostasis, serum phosphate is poorly correlated with dietary phosphate. So we can't say feed X amount of phosphorus and your serum phosphate will be Y. It doesn't happen that way because of metabolic adjustments and homeostasis. So the key players that are involved in homeostasis are parathyroid hormone, fibroblast growth factor 23 or FGF23, 125 dihydroxy vitamin D3, which is the active form of vitamin D3, and renal alpha klothos. And these players together can affect the uptake of phosphate from the intestine. It can increase it or decrease it. They can increase or decrease phosphate going into or out of the bones. And more, and probably most important, they influence how much phosphate is excreted via the kidneys and into the urine. And FGF23 is one of the really key players on that. And what we know now is that FGF23 is elevated well before PTH as well, but FGF23 is one of these factors that's elevated well before changes in serum phosphate. So we can now measure FGF23. There's a commercially available assay now that we can measure that and use that to give us a better indication of what's going on with phosphorus homeostasis, even when serum phosphorus is normal. So when serum phosphorus increases, there's all kinds of things. As they say, the S hits the fan. It can contribute to calcification of blood vessels and endothelial dysfunction. It can cause direct cellular toxicity. It can stimulate secondary hyperparathyroidism and also contribute to loss of minerals from the bone and contribute to secondary orthopedic or bone diseases. It can contribute to immune dysfunction and renal anemia, oxidative stress, and so many different things, and ultimately has a very negative effect and contributes to kidney disease progression, including end-stage kidney failure. So it's really important, based on everything we know so far, to keep phosphatemia in check. There are multiple studies in multiple species that show reduction in serum phosphate in chronic kidney disease is beneficial. Now, how do we get there? There's only one study in cats that looked at reducing serum phosphate intake with no other changes, just serum phosphate. And that was a study that looked at 1.56% versus 0.42% dietary phosphate. So a moderate amount of phosphate restriction. And in that study, the cats were fed for a year, and there was no difference within that year in glomerular filtration, urinary nitrogen, serum creatinine. But over the course of the year, there was a significant decrease in parathyroid hormone. There was a possible increase in survival. It wasn't statistically significant, but that is probably because it was a fairly small study and because it was a relatively short-term study. As we mentioned from the get-go, chronic kidney disease in cats can be slowly progressive and could take sometimes multiple years for it to progress. And so there may not have been as pronounced of changes seen here because it was a fairly short-term study. Yet it was long enough to show that there was significant damage, histologic or microscopic damage to the tissue of the kidneys in the high phosphorus diet. So we know that phosphorus is important for cats. What we don't know is how much phosphorus should be in the diet. Let me share with you a couple other studies that looked at other ways to get serum phosphate down. One was using a normal diet and phosphate binder. So it's binding the phosphorus within the intestine and preventing it from being absorbed. And that led to a reduction in PTH and serum phosphate. And then, of course, there's multiple studies with commercial kidney diets with or without phosphorus binders, and they also showed a reduction in serum phosphate, and a reduction in serum phosphate seems to be beneficial in terms of progression of kidney disease. So important findings. And with that in mind, IRIS, the International Research Interest Society, who establishes guidelines for grading and treatment of kidney disease, their guidelines say that keep serum phosphate in the low normal range. They don't say how much dietary phosphorus to feed because we don't know because of homeostasis. So monitor serum phosphate and put it in the low normal range. Now, a new addition to the IRIS guidelines is also do that while avoiding hypercalcemia. What has come to light in recent years is there is an association from feeding low phosphorus kidney diets with the development of hypercalcemia or elevation in calcium in the blood in cats with chronic kidney disease, which could be a risk factor for mineralization of tissues and progression of renal dysfunction. So there's a couple of studies that are starting to look at what is that role of phosphorus and how much phosphorus needs to be there and when. And so this particular study They were feeding a very low phosphorus diet, and the cats were at greater risk for developing hypercalcemia, meaning some of the cats developed hypercalcemia. And that was compared to a moderate phosphate diet, which had almost twice as much phosphorus in it, but was still moderately restricted from a maintenance diet. The moderate phosphate diet decreased hypercalcemia in cats that had been fed the low phosphate diet. So that tells us that phosphorus restriction is not without limits. We know that too much phosphorus in the diet is going to be detrimental. We know that too little phosphorus in the diet can be detrimental. And it still remains to be defined exactly what is ideal. The science needs to be done. So coming back to the IRIS guidelines, specifically on this topic of hypercalcemia, what they say is that cats with serum phosphorus within the IRIS target range, remember normal, that they are at risk of developing hypercalcemia when they're put onto a low phosphorus renal diet. That doesn't mean don't do it, but it means that there are a couple things that should be done, including measurement of FGF23 to help identify cats that might benefit. If the FGF23 is increased, in this case above a threshold of 400 picograms per mil, in the absence of hypercalcemia, anemia, or marked inflammatory disease, that would be an indication to start phosphate restriction. And when you put any cat onto a phosphate restricted diet, it is recommended to monitor serum calcium. And if it goes up, if it exceeds 12 milligrams per deciliter, it's recommended to switch the cat to a less phosphorus restricted diet. I want to switch now to talk about dietary phosphorus in cats that do not have kidney disease. Does dietary phosphate harm healthy kidneys? It's been known for decades that a high phosphate diet can cause damage to the kidneys in rats, but it's also known that it's not an absolute the phosphorus is doing it because there's other dietary aspects that play into this equation. The calcium to phosphorus ratio is important because even in the intestine, increased calcium will reduce phosphate restriction, increased calcium will reduce phosphate absorption and vice versa. Likewise, dietary magnesium will interfere with calcium and phosphorus absorption. And so the ratio of these things within the diet is important. Also, the phosphorus source is important because some phosphate sources are much more bioavailable than others. And so talking about high phosphate independent of these other variables, you cannot get a viable answer to whatever question you're asking. It's important to consider the whole aspects of the diet. So I want to talk a little bit about what about in cats, because this has been a big thing in cats in recent years. Let's start by talking about the sources of dietary phosphorus. Quite often, if you look at the literature today, you will see terms organic phosphorus versus inorganic phosphorus. And generally, what they're referring to is organic is any phosphorus that's coming from natural feedstuffs, and inorganic is anything that's coming from mined sources. But then they don't necessarily mean it that way either, because when they talk about the detrimental effect of inorganic sources, quite often they're referring specifically to the highly bioavailable sodium phosphate salts. And there's a big difference in the bioavailability within the inorganic category and within the organic category. For example, the phosphorus in meats and animal byproducts are much more bioavailable than in grains, which might be bound with phytates. So, in my opinion, as a nutritionist, the terms organic and inorganic relative to dietary phosphorus are misleading and inadequate. I prefer this other categorization, which would be nutritional sources versus functional sources. Nutritional sources are those that are provided in the diet specifically to meet the nutritional needs of the animal or person eating the diet. Phosphorus is indeed an essential nutrient. We must have it. Cats must have it. And so there has to be sources of phosphorus in the diet, whether it's animal tissues, whether it's grains or other substrates, or mined phosphates, such as tricalcium phosphate, dicalcium phosphate. These are all there for the purpose of meeting the nutritional needs of the cat. On the other hand, there's the functional sources. These are phosphates that are added to the diet for a purpose, but not specifically to meet the nutrient needs of the cats. They may be there for preservation of the food or structure of the food, or even for the flavor. They might be there, for example, phosphoric acid. They may be there for acidification to help in the management of struvite urolithiasis, for example. The phosphate salts that we will see in the next few slides, the sodium, calcium, or potassium phosphate salts, and especially the sodium phosphate salts, are very highly bioavailable salts. And that's an important distinction between these salts and most of the other phosphate sources. So let's move on. In cats, the intestinal uptake of the sodium phosphates, I mentioned they're more bioavailable, it was twofold greater with the sodium phosphates compared to phosphates from basically animal and fish and poultry. And so we know there's a difference in the bioavailability, and that can influence the potential effects that this might have on cats. So I'm going to share with you a number of different studies here in just a moment. Excuse me. So the first study, 1995, was looking at a number of different diets where they were using some of these sodium phosphate, highly bioavailable phosphorus sources at 4 different levels, 0.6, 1.2, 2.4, and 3.6 grams of phosphate per 1,000 calories, or in millimoles if you prefer. And they added more phosphorus to the diet. So they started with the low phosphorus diet and added doubled. But they did not add calcium. So the calcium phosphorus ratio with each increment of phosphorus, the calcium phosphorus ratio decreased. So it went from 1.8 all the way down to 0.3. And then these cats were fed with a crossover study about a month on each diet. And what was found is that plasma phosphate and creatinine clearance, a marker of kidney function, decreased with the higher phosphate. So that is early evidence that some bit of damage may be occurring with that high phosphorus, low calcium phosphorus ratio. And there was also in this study evidence of the interactions between calcium, phosphorus, and magnesium relative to uptake from the GI system as well as urine excretion. So this was one of the early studies in cats looking at this and showing, yeah, maybe something's going on. More recent studies out of Germany, Dobenecker and others, they looked at home prepared diets with sodium and calcium phosphates added. And again, looking at a high phosphate diet versus a lower phosphate diet without adjusting for the calcium phosphorus ratio. And they found, again, evidence of kidney damage in the cats fed the high phosphorus, low calcium ratio diet. Another study from the same group, they looked at similar amounts of calcium, but they adjusted the calcium phosphorus ratio and held that constant at 1.3. And there was not as much damage, and it was only occurring in the cats fed the sodium phosphate salts, not those fed the calcium phosphate salts, even though fed in the same amount. The next study looked at, again, home prepared diets with different phosphate sources. In this case, looking at total phosphates similar to prior studies with calcium phosphorus 0.9 to 1.3. And it was observed that there was glucoseuria, so sugar in the urine, which is not normal, was observed with all the diets. And there was microalbuminuria, which is a type of proteinuria, and increased urine protein creatinine was observed in those fed the lower calcium phosphorus ratio diet. Another study, again with calcium phosphate for the highly bioavailable potassium phosphorus salt. In the diet, again, calcium phosphorus ratio was very low, in this case, 0.4 to 1. It induced kidney damage, but when the calcium phosphorus ratio was 1.3 to 1, there was no damage. Another study, again, looking at different levels of these highly available phosphate salts with different calcium phosphorus ratios. In this case, after 1 month, they could see that GFR and renal morphology were already changing, showing some evidence of damage. And so a change in the diet was applied so that the high phosphate diet wasn't as severe. And at 4 months, then there was no change in GFR, but still some minor changes via ultrasound. But one of the things about this particular study is a lot of the cats developed kidney stones, whether or not that was unrelated to the diet, because it was across diets. So that made it difficult to interpret. And basically, so 6 different studies, and there's actually more, but what they're all showing is the same thing. High amounts of inorganic phosphates, especially sodium phosphate, can cause damage to the kidneys in previously healthy cats. But the source and the amount of the phosphorus, the calcium phosphorus ratio in the diet, and other factors have an impact on that. What's also important to recognize is that phosphorus in normal foods and ingredients does not appear to have the same effects. When high levels of serum phosphorus, when high levels of dietary phosphorus were fed, the same high levels, but when it was coming from animal source protein, meat and bone meal, that kind of thing, and not from these highly soluble phosphates, no adverse effects were seen. It's also important to note at this point in time, there's no evidence that phosphorus in commercial food causes harm. And I emphasize that this is at this time because I do want to point out something. This table is giving you a summary of the phosphorus and the calcium phosphorus ratio in those research diets that we just saw, as well as evidence about the phosphorus and the calcium phosphorus ratio of diets in the United States predominantly, and a little bit of information from Brazil. So the research diets I divided into those that induced some kind of adverse effect versus those that were the control or did not have an adverse effect. And what you can see is that the phosphorus levels are fairly high in the adverse group compared to the control group. So 3.6 was the low end on the adverse, 3.2 was the high end in the normal group. But the other thing is the calcium phosphorus ratio. In the adverse group, the calcium phosphorus ratio was always less than 1 to 1. And I think that's really important. But let's look at the commercial dry diets. The mean is probably not important so much as the range. And you can see that there are commercial diets that have phosphorus in the range that was seen in the adverse diets. So you can see commercial diets 4.9, 5.8, 5.2 on the high end, which is well above where the adverse effect was seen in the research diets. What's likely different is the source of the phosphorus in these cases. Those high phosphorus diets are probably diets that are high in animal product, animal bone meal, things of that sort. And we look at the calcium phosphorus ratio, And we can see that the average calcium phosphorus ratio for commercial diets is about 1.3, 1.4, which is above 1, and that's great. But we can also see there are some commercial diets that have a calcium phosphorus ratio less than 1 and as little as 0.5 in some wet diets. And the evidence from the research to date suggests that a calcium phosphorus ratio less than 1 to 1 is a risk factor for problems associated with the phosphorus. We certainly don't want to be feeding a cat a diet that has a calcium phosphorus ratio less than 1 to 1 and with high phosphorus until we know more about the different phosphorus sources. So I think we can say that more research is needed from different phosphorus sources, as well as calcium phosphorus ratios, long-term effects, things of that sort. Currently, the recommendation is avoid excess inorganic phosphates, although we don't know what that is defined as, and avoid diets with calcium phosphorus ratio less than 1 to 1. So I want to summarize where we are so far. What we know regarding phosphorus in chronic kidney disease is that excess is harmful. What we don't know is how much is too much and how much is too little. We don't know the impact of phosphorus source in cats with chronic kidney disease, but we can assume that the high bioavailable phosphate salts would be detrimental, but we don't have any evidence of that at this point in time. But the other thing to consider is the impact of other nutrients in the diet, whether it's the the magnesium level, the calcium phosphorus level, dietary fiber that can reduce absorption of phosphorus. Even acid base can have an effect. What we know regarding phosphorus in healthy kidneys is that highly soluble salts, especially those sodium phosphate salts, can be harmful in excess. But what we don't know is the max safe level of soluble salts. We don't know the impact of the less soluble phosphate salts, the impact of other nutrients on the diet, the long-term versus shorter-term impact, because all of these studies were relatively short-term. And what happens if you get very, very mild changes that accumulate over many years? We don't know. And final point here is what we don't know, what we don't have are markers of injury to the kidney that we can look at this without actually damaging the kidney. If we had a way to say, oh, you've bruised my kidney, stop it, and then you stop it and the kidney comes back to completely normal, that might let us do more studies than if we had to cause kidney disease before we can know that something is having an effect. And I want to point out here, while we're talking about what we know, what we don't know, what we're looking for, is every cat has a funding opportunity for researchers to try and look at some of these exact things, looking at markers of kidney injury, looking at the effect of phosphorus on the kidneys and other dietary aspects of that. So if you're a research scientist or know somebody that is, be sure to send them to every cat to look for that. So again, summarizing where we are on key nutrients, I think it's safe to say that phosphorus restriction is beneficial in chronic kidney disease, but notice the asterisk, the caveat. We really don't know how much phosphorus restriction is important, and we know that too much is bad, too little is bad, and somewhere in between is good. But where the limits of that in between are, and how do we control for the effect of phosphorus sources, for example, there's still data to be generated, still much to be learned in that regard. Is protein restriction important? I think based on the scientific evidence, unlikely is the answer. The same for sodium restriction. Based on the scientific evidence, sodium restriction is probably not beneficial in chronic kidney disease and has the potential to be detrimental. Potassium supplementation, yes, to correct deficiency, but no evidence that going above and beyond that is beneficial. The omega-3 fatty acids, antioxidants, and alkalinizing buffers are all likely to be beneficial, but in each case, they're still unproven. So I want to switch the last couple minutes and talk about something that's not specific to chronic kidney disease, but rather to cats. As we mentioned in the very beginning, chronic kidney disease is common in older cats. It's typically slow progression, and it typically involves the tubulars, not the glomerulus. And that is important because while these cats are living with their chronic kidney disease, we want them to live as long as possible. So it's important that we feed the cat, not just the kidneys. So let's talk a little bit about the needs of geriatric cats relative to diet. Some of the unique needs of aging cats is the need to preserve weight and lean body mass. Cats lose weight as they enter the geriatric years. It's this graph is showing the percent of cats and dogs that are underweight, and you can see that starting at about 12 years of age and really high after about 15 years of age, a high percentage of cats are underweight rather than overweight. So we need to focus on that. We need to focus on providing calories. We need to focus on providing enough protein as well as other nutrients. What we know about aging cats is that weight loss is common. Um, it's also common in cats with chronic kidney disease. So it's important to separate the two. But one thing that's been observed is that weight loss happens in cats that are apparently healthy. And yet it might be an early indicator of subclinical disease. So as veterinarians, if you've got a cat coming to your clinic and you have weight loss and no explanation for it, it's important to monitor that. But any weight loss should be investigated. So, and certainly in cats, it's important to evaluate weight change on a percentage basis. You know, a cat's only lost a half a pound, big deal. But on a 4-pound cat, that's a pretty high percentage. So it's important that we look at weight change in cats on a percentage basis. And especially in senior cats, any unexplained weight loss should be considered a flag and look for an underlying cause. And you won't always find one because even apparently healthy senior cats tend to be losing weight. So that raises the question, can maintaining weight and lean body mass delay morbidity and mortality? Now, there's not much evidence to support an answer to that, but what evidence there is says yes. There's a study that was published by Carolyn Cupp where she looked at 90 cats, senior cats at the start of the study, and she followed them until end of life, natural end of life. And what she found was that preservation of body weight, preservation of lean body mass, and even preservation of body fat in these cats, non-obese cats, all helped to prolong their survival during the course of the study. And we know in clinical studies, whether it's kidney disease, cancer, or other, we know that maintaining body weight or cats that are higher in body weight compared to those that have lost weight, they have a greater chance of survival or living longer. So the evidence suggests that maintaining weight is important. Speaking of lean body mass, sarcopenia is a problem in essentially all species studied to date. And sarcopenia basically is an age-related loss of lean body mass or muscle mass unrelated to disease. So it's not cachexia, it's not diet-induced loss, it's just age-induced loss. And what we can see in this graph is that cats, normal, healthy cats, lose lean body mass with age. And this, unfortunately, this happens in people as well, dogs and other species. So what can we do about it? I don't have the time to go into the details, but one of the things we can do with it is make sure we're providing adequate protein. Cats need about 3 times more protein to maintain lean body mass compared to the minimum just to maintain nitrogen balance. what it translates to is about 34% of calories from protein for adult cats, but geriatric cats may need even more, in part because of reduced digestive function as well as reduced metabolic efficiencies. We know that from several studies that geriatric cats have an increase in their maintenance energy requirements, starting at about 10 years of age, and then progressively as they age, their energy requirements increase. And part of that might be due to decreased digestive function. About 30% of cats and 30% of cats have a reduced ability to digest fat. About 20% have a reduced ability to digest protein. And so if they're not absorbing and using the nutrients they need to consume more of it. So bottom line on this is geriatric cats have increased energy needs, they have increased protein needs, and they probably need a diet that's highly digestible. So if we look at the nutrition of aging cats and chronic kidney disease cats, remember many geriatric cats are losing weight, they're losing lean body mass, they have reduced digestive function. Many chronic kidney disease cats are geriatric. They're losing weight and lean body mass. And they can live for many years with chronic kidney disease. So we need to make sure that we feed the cat, not just the kidneys, as much as possible, maintain weight and lean body mass. Sometimes that means putting a feeding tube in. For cats that have advanced chronic kidney disease and they just don't want to eat, put a feeding tube in, and quite often in that case, they can live for additional years. Most of you are probably familiar with the study that Sherry Ross did with for cats with chronic kidney disease, fed maintenance diet versus commercial renal diets. And one of the key things from her study is making sure those cats had enough protein intake, enough calorie intake, enough food intake to maintain weight. And that meant using a feeding tube in many places, in many cats. And certainly once the cat and owners get used to it, that's a great way to provide quality of life for quite often additional years. So it's very important that we feed the cat and as much as possible, maintain weight, provide complete and balanced nutrition, and then address the changes induced by chronic kidney disease. So with that, I thank you. I think we have some time for questions, or at least we'll take a few questions.
We do have, and we have some great questions here. I do have a couple that are asked that are a little more detailed. So those are the ones that I'm going to kind of put on the sheet for you, and I'll send those off to you for answer a little more. These are definitely some in-depth questions.
Sounds good.
Let's start with, and I'm not sure if I'm saying this right, Varenzin. It's a drug. A treatment, VARENZIN-CA1.
Well, the nice thing as a nutritionist, I don't keep up with the drug, so I'm probably not going to have a good answer for this person.
Okay, let's see. So as far as I know, it's a to manage CKD related anemia.
Okay. All right. Well, we certainly know that anemia is a common problem, and there's several different drugs, erythropoietin and so forth, that stimulate red blood cell production, and I think these have been generally considered to be beneficial. But I right off the bat say I'm not familiar with most drugs, so I will basically defer answering that question and let that go to a internist or a renal specialist.
Okay, this is a question that I think gets asked a lot. Can cats develop CKD over time because they tend to drink infrequently or seemingly very little? How much really does getting a cat to drink affect development of CKD?
Okay, that's a really good question. And it's sort of a hot topic these days, people thinking that cats need to drink more. And the reality is there's no evidence that drinking too little or too much in cats that are maintaining water balance, and that's the key. If they're maintaining hydration, the amount they drink is probably not all that important. Once they lose the ability to maintain water balance, in other words, once they have renal dysfunction or if they have some other problems, getting water into them might be important. But normal healthy cats have homeostatic abilities. They are able to drink enough water, and if they drink too much water, they'll just pee it out. I have some evidence. Unfortunately, we didn't have time to put that into this slide set, but there's certainly evidence that you can increase water throughput by, feeding wet diets exclusively, by feeding, getting cats to drink from, running water. Some cats like fountains, some cats like flavored water, and so forth. You can force more water into the cat, and when you do that, they pee more. But there's no evidence that that actually provides a health benefit to the cat. So it's something that might be beneficial for cats that have urolithiasis and you want to increase the flow. But other than that, there's no scientific evidence that giving more water, getting the cat to drink more, is going to do anything to protect the kidneys.
Okay. So this person's cat has IBD and CKD and CKD. Double whammy.
Yes.
She says we're focusing on IBD treatment. He's receiving steroids and some supplements, but Cap K for CKD, unfortunately, he has a poor appetite and he's losing weight. But she says his potassium is within range. So I'm wondering. I think the question is, what can they be doing? What can they be doing to? Is this the right? I guess is this the right approach?
Broad stroke, I would say it is the right approach to focus on the intestinal aspects, because that probably gives you more restrictions in terms of the diet, and then you can work within that to make whatever adjustments are needed for the kidney. Hopefully you're working with a boarded nutritionist that can help with what's important. Of course, when you have disrupted intestinal absorption, that might be influencing not only your minerals, but your electrolytes, your acid base balance, and so it's probably important to keep a close eye on that. Make sure that there is adequate potassium and sodium in the diet, while obviously avoiding excessive amounts of phosphorus. So again, I think it's probably relatively straightforward addition to the GI aspect for a boarded nutritionist to develop.
Okay. And would that be, I guess when we talk about boarded nutritionist, would that be contacting through your vet or the boarded nutritionist and they would recommend a diet formulation for you, or would they do something specific to your cat? How does the nutritionist work?
Okay, so they can reach out to the American College of Veterinary Nutrition, which is actually now a subspecialty under ACVIM, but you can reach out that way and find a nutritionist that does consults. Most of the boarded nutritionists that do consults work through the primary care veterinarian. So the vets can contact them, give them the medical history, and then that nutritionist can then provide back to the vet what's needed for the cat. There are some nutritionists that provide consults for cat owners and dog owners, but predominantly in that case, it's going to be only for healthy animals, because it's important to have that animal veterinary relationship before you start doing therapeutic diets.
Okay. So in other words, seeing a nutritionist as just another tool in the box, the same way you would see, have a cardiologist or have you still have your general
Exactly.
practitioner, but just with the addition of that another tool in the box, so to speak.
Exactly. Exactly.
Um, so this lady says that she is on her fourth CKD cat, but no vet has ever suggested an ACE inhibitor.
Well, I'm going to assume that her cat does not have advanced proteinuria or issues that would require an ACE inhibitor.
So how would she go about, I guess, what questions can she ask a vet to determine whether or not, I know this sounds kind of weird, but whether or not he or she is up to date on current CKD treatments and information.
Um, I think the easiest way would be to talk to the vet and ask what kind of treatments they use, or simply ask, hey, when do you use ACE inhibitors, or don't you? And if not, why not? And just ask them straight up, because a lot of veterinarians will choose a portfolio of treatments that might be different than the person next door. In many cases, there's very good reason for that, um, without it being that they're not up to date. Maybe they're very much up to date, but they have their reasons that uh, priorities are given for one drug or one treatment over another.
And as a cat owner, if your cat's diagnosed with kidney disease, even early stage, you have to educate yourself too. So ask questions, um, attend attend webinars like this. You need to stay on top of it just as well as your vets do too, correct?
I think that's important, and in part because there's a lot of lifestyle issues that maybe aren't going to cause kidney disease, but they might aggravate it. For example, if you switched your primary care veterinarian and you started going somewhere else, and you took your cat in for a routine procedure, a dental cleaning, or minor surgery of some kind, and for any reason they didn't know that the cat had kidney disease, um, I think they would be important, because things like anesthesia is a risk factor for making it worse, or any kind of boarding a cat, that could cause any kind of
Mm.
stress to a cat. You want to make sure that while the cat is under that stress, whatever it may be, boarding again, that they're eating properly, and more important, drinking properly. So those are things. It's just important to know what can influence the health of the kidneys and what can make it worse once the damage has started.
Okay, my cat was diagnosed with early signs of kidney disease. He has an elevated ALP and FPL, hypertension, plus the urine is not very well concentrated. In your opinion, she's asking, what is the best next step to prevent progression or decrease progression? And would a GI panel to check nutritional deficiencies have value or be a start?
Okay. Unfortunately, blood panels to look at nutritional deficiencies are extremely useless, to put it mildly. They're just not sensitive enough, unless, I mean, there are certain things you can do if you suspect a given nutrient, a specific vitamin, or calcium, or whatever it might be. There are certain things you can do, but because of homeostasis, where the body carefully regulates what's in the blood, regardless of what's going on in the muscle or the liver or whatever, um, the blood doesn't necessarily reflect what's going on in the animal. So I think that would be, in my personal opinion, that would be a waste of money. That said, what are the next steps? That cat that you're describing is not really early kidney disease. It's more middle. And so it is important that you make sure that it's eating well, and it has an appropriate diet, and that your vet is testing the cat on a regular basis to make sure that things are not progressing. But assuming that all that continues, that cat can very well have a wonderful life for years to come. But it's important just to make sure that you're doing, maintaining good quality of nutrition for that cat and hydration.
So this person is seeing an internal medicine vet for her cat's CKD, and she's wondering about the FGF23 test. Valuable? Yes? No?
I think if it's indicated it's valuable, I personally think in the future, when we know a little bit more about it, I think we might be doing it more routinely than we are now. But I think it does give us an indication of it might influence a choice of diet for a cat, because of the fact that it goes up before phosphorus goes up. And do we want this cat on a early renal care diet or a late renal care diet, or even just an over-the-counter diet, which is going to be most appropriate for this cat? And I think the FGF23 will help influence that decision.
And as far as I know, the FGF23 test is still a send-off test, right? That's not.
It is a send-off test, yes.
Okay, so blood has to be drawn and then sent off. Okay.
Yes.
There's a request to AAFCO to reconsider the calcium phosphorus levels in nutrient profiles. Are you in favor of this?
I am in favor of looking at the data and seeing what is supported. I think that I think there should be a calcium phosphorus ratio minimum of 1. There is on the dog side. There's there's more maxes. There's a little bit more guidelines on AFCO for the dogs than there is for the cats, and I think that we might still need more evidence before defining that, but I think we should be working towards that.
Okay. I guess one of the things I noticed in a lot of the studies that that you talked about in your presentation is some of them are 10, 15 years old. Why is nobody doing or wanting to do feline kidney research?
I think 2 things, but I think the biggest thing is that without markers of early changes, it's hard to do the studies without inducing damage, and nobody wants to cause kidney damage to the cats. Nobody wants to harm the cats. And so until we have the markers that will let us safely do the research, I think it's difficult to move forward to the next steps.
But it is possible, yes, to do a study in cats that already have early CKD to look at those markers. Is that correct? Is that possible?
Yes, I think to look for markers, it is possible. The challenge is the ethics of doing clinical studies in pet animals. If you, for example, wanted to do a study where, I'm telling you that there's really no evidence that protein restriction is beneficial, so you want to feed a diet that doesn't have protein restriction, then you have to have that question of informed consent, because the consensus is phosphorus and protein restricted diets, and you're going against consensus to test something. And so those cat owners have to be willing to let their cat be fed a diet that is different from consensus. So that's one of the issues is how do you justify that control diet in order to actually look at the study? On the worst case scenario, it's like, well, we don't have any scientific evidence that parachutes actually save lives, but would you want to be in the control group?
That's Great. Oh, that's a great analogy. That is a great analogy. I know I do see from time to time, I see studies go by where they're asking for, they've got clinical trials going, they're asking for uh, consent, owners to consent to enter their cats in the trial. And I'll be honest, most of the cat owners that I've spoken to would be willing, I think, to try anything, because right now it's just how it's going to end. That's just there's no option right now. There's nothing to, yeah. So do you wait until the UPC is 0.5 to treat, and if so, what medication?
I think the challenge with protein creatinine ratios is a single measure versus measures over time. So if you see serial measures in a cat and it's increasing, I think that's an indication to consider treating sooner. But if you don't have those serial measures and you take and it's 0.5, I actually wouldn't do anything until I got another measure. Because I think stability of all of the renal functions, you have to make sure the cat is stable, hydrated, and then you get serial samples, and then you can make your informed decisions to whether you're going to use an ACE inhibitor or something else for that.
Okay. What about Science Diet YD for cats that have hyperthyroidism and early kidney disease?
I'd rather not comment on specific diets, but I will say that diet, at least as originally formulated, was, in my opinion, too low in protein for senior cats. So it's not a diet that I've ever recommended for anybody.
So that, I mean, when you talked about the kidney disease with restricted protein, doesn't seem to have, doesn't really do anything for cats with early kidney disease. So again, if your cat has early kidney disease, would you need to supplement, or?
Well, that's the whole thing with the thyroid diet. You can't supplement because that
Because
it interferes with the restriction
yeah,
of the iodine.
okay. Do you have
So
any?
if you do have a patient that, like, you're considering what to do, I would say that is a question to refer to the Hills Help Desk.
Good idea. Good idea. Do you have any specific recommendations for potassium supplements?
No, I mean, there's several commercially available, and I don't have a specific recommendation on that.
Okay.
Sorry.
Is there anything that you should watch out for?
The only thing I would suggest watching out for is all of the over-the-counter, overhyped things, supplements that are recommended for cats that their primary scientific evidence is people's opinions and people sharing how wonderful it was for their cat. I was looking at one a little while ago, and it's like, what's in this? And you can't even find out what's in it, but oh, it's wonderful. It made my cat wonderful. But I would look for stuff that has scientific evidence behind it, not opinions.
So I know we're at 25 after the hour. I do have a couple more really good questions. Are you okay to stay for about 5 more minutes?
Why don't we put those on the document that
Okay.
we're going to have, and then I'd be happy to give people more
Okay.
detailed answers.
Okay, that I just have one more question. That this one came up, and I have not heard of this at all. Asking about a shot that's being developed in Japan that's going to be a cure for CKD.
It's the AIM protein, apoptosis inhibitor of macrophages, if I remember correctly. So it's a protein. The theory and the early evidence is that what happens is you've got this AIM protein is missing, and it allows crud, if you will, to accumulate in the tubules of the cats. And by supplementing that protein, it allows the macrophages to do their job and clear up all of the crud and clears out the tubules and allows the kidney to function normally. That's the theory. There is a little bit of evidence that's highly experimental that talks about how this works. They have identified the protein, and from what I understand, they actually are taking this protein and putting it into diets and feeding it to cats. What I don't understand is how this protein in the diet is going to get through the digestive system, which breaks down proteins, and get absorbed and somehow make its way to the kidney and provide a benefit. I've not seen any evidence that it will do what it claims to do. There's rumor that there's clinical trials currently underway. I don't know anything about such clinical trials, what they're looking at. It was a really fast timeline to get from the basic research laboratory to a clinical trial. It's just a few years. Fantastic if it works. But right at this point in time, I have no reason to think it will. But the other thing is, if you look at TikTok and YouTube talking about this thing, it talks about it's going to cure kidney disease and it's going to make cats live to be 30 years old. I wouldn't count on it.
That would so be the game changer, wouldn't it?
Wouldn't it? It'd be
Oh my
fantastic.
gosh. Gosh. Okay. So, you are going to get a list of questions, just because, do you want to go ahead and flip to the next slide real quick? I will be sending you, if you didn't get your question answered, I will be sending them on to Dr. Laflamme. She will answer them, and then I will be sending them out. I will be returning them back to you after she's answered them. I really do appreciate everybody being here. Kidney disease in cats has, since I started in veterinary medicine, that's always been just it's because you can't do anything. You feel like you just, and the sad part is that once we know there's a problem, it's too late. So I really appreciate all that you've done. And I really appreciate the researchers that are doing the work right now. But I certainly wish, if you know any researchers, anybody that wants to do research, and please send us a proposal. We want to look at them. And again, those proposals are supported through our sponsors and by our generous donors. You can actually hit the QR code that's on your screen right now if you would like to donate, or visit our website at everycat.org. We do have a particular kidney fund that you can give to, and you can also do so in memory of or in honor of a cat that you loved and lost. So, Dr. Laflamme, I appreciate your time. Thank you so much. And I look forward to what the best thing about veterinary medicine is. I look forward to the next thing, you know.
Yeah, it'll be interesting to see what comes down the pike.
Thank you.
Thanks, everybody.